had knee injuries or specifically those along the lines of a total knee replacement. If you are currently suffering of knee pain or hip pain, you can use these interchangeably to kind of help with progressing your strength and your range of motion as you recover and heal from whatever it is that you're suffering from. As always, we are not here to replace any recommendations or instructions that your doctor or therapist has already provided for you. We're just here to enhance your process. So, as we are streaming live right now from YouTube, Instagram, and Facebook, if you would please give me a thumbs up as to where you're located. And if you happen to have any questions along this series, make sure and list them in the comments section and I will address them as they come up. I have got a lot of years of experience in working with recovery from orthopedic injuries such as total knee replacements and a lot of injuries that we can sustain in the knee, whether it be an ACL tear or a meniscus injury, or you might have patellofemoral syndrome. There's a lot of different things that can cause pain in the knee, but nonetheless, we do a lot of the same exercises in order to help guide that process along for a healthier version of you. So, super excited to be here with all of you today, and I hope you are able to walk away with some new ideas as to how you can use Life Pro and the different products and our expertise to make your rehabilitation experience more comfortable and definitely more progressive. So, good to see you, Debbie, coming in from Virginia. Happy to see you here today. I'm here in Indianapolis, Indiana. Well, west side of Indianapolis, I should say. I'm in a very rural setting, but I'm here in my facility where I see individuals for purpose of pain relief and for strengthening. I've been in the sports medicine industry for over 20 years and never gets old. But a lot of the things we are doing in order to accelerate recovery and pain management is offering a different variety of products, which LifePro now offers for residential use that we've been using in the professional setting for several years. So I'm excited to represent those products and that I use them here in my facility, and you get to use them from the convenience of your home, which can help in alleviating pain, increasing your range of motion, improving your strength, and overall improving your own mood, because pain makes us go crazy, I think. And so all of these different products that we have and different techniques you can use with these products will help in providing more peace, more recovery, more relief, and just a happier version of you, which makes life a little easier to get by with. So um, I've got a variety of different things. We've got massage guns. We've got the whole body vibration platform here on the ground. One thing I want to talk to you about when it comes to using the vibration platforms, if you are suffering from a knee or a hip problem, whether you've been diagnosed or undiagnosed with pain, if you have the choice of purchasing a platform or if you already have one at home or you're on the fence with one, you want to make sure and choose one that is completely flat if you have the choice. If you don't have one that's flat, you can actually modify it by putting a mat or a layer of mats on it in order to keep your feet as level as possible. Because what happens when we are on a banked or a curved platform is if we put our feet in alignment with that, is our knees change alignment, which puts more pressure in the knee joint. And the same thing happens with our hips. Now, some of you might wonder, well, why on earth do you offer a curved platform then? Well, because if we are trying to activate muscles here on the outside of our thighs or on our inner thighs, which are very common in those who have knee or hip injuries or even back pain for that matter, we can actually use that curve to our advantage by pushing into the curve, and then the curve sends energy back into those muscles. It's a little harder to do that when you're on a flat platform, but the trade off is if we are recovering from surgery or we are recovering from an injury, we're able to position ourselves flat on that surface, which is sending energy up through the body, the lower extremity, and we're receiving that energy in a neutralized position versus having to bank or push our feet into a different altered state. So there's advantages of both and there's disadvantages of both. But if you have the choice and you're in the older, I'm going to say 50 or older, and you are knowingly going to be having a total knee or a total hip replacement, or you've already had one and you're looking for using this for pain relief, you're better off in going with one that's completely flat. So um, let's see here. My husband had torn meniscus surgery going post-surgery for about a month now in PT session. Any suggestions? Absolutely, Jess. I'll definitely get you some ideas. So the idea or the question is, when you have had an injury to the knee or when you are in recovery of total knee, total hip, when is the best time to get on the platform? And the answer to that is going to be when your therapist or your doctor tells you that you can start working range of motion and you can start uh, walking for the purpose of fitness or riding a bike. Then it's safe to say that you can get on your platform and start receiving that energy. Now, when it comes to trying to regenerate the energy through our body and the communication pathways between the brain and the foot, that can start immediately. But what we don't want to do is we don't want to create lateral shifts. So if you have a turbo at home, or if you have the Hovert or one of our single motor units like the Waver, you can actually get on that pretty quickly within within a week or two after your surgery. We don't want you necessarily loading on it, so it's better if you go non-weight bearing. And so what I'm going to do, I'm going to show you what I'm talking about with that using the Rumble X Plus. And the Rumble X Plus, the reason why I love the Rumble X units is you're able to actually modify using single motor units. When it comes to the Rumble X, you can actually program it to be a Waver or a turbo. But when you get to the point where you're ready to start using it for weight loss or trying to use it for pain management and getting 3 or 4 dimensional whole body vibration, if you have the Rumble X, you're getting a tremendous amount of stimulation that's different from our single or our double motor units. So if you have the opportunity to buy a Rumble X now, or if you're wanting to upgrade what you already have, the Rumble X Plus and even the Rumble X Pro or the Relaxivibe, they all have the ability that you can actually use manual mode function and turn it into a single motor or a double motor unit versus having to receive all of the energy all at once. So what we're going to do, and I've got a stool that's on rollers. I don't recommend you do this at home, but this is what I'm going to use because it's handy and it's at the height that I can work with. I might go out and get my stepping stool here in just a moment. But on the Rumble X Plus, we can isolate the programming in manual mode and choose 1 motor, 2 motors, or 3 motors, or we can use a combination of those. If you are just now coming out of surgery within the first week, we can actually just experience a little bit of oscillation, which is our teeter-tottering movement. And on your device, it'll look like the up and down arrows. And you can isolate that with pulsation, which is just a gentle tickle underneath your feet. So I'm going to do that right now. I'm going to go into manual mode. And if you, depending on which device you have, if you happen to have, let me go ahead and set this. There we go. If you happen to have the turbo or the Hovert, just choose a level that feels most comfortable to you because it's going to be different for everybody. Right now, I'm just on a level 1 of speed. And the idea of this, whether your feet are close together or whether your feet are wide apart, the idea of this is just getting the fluid moving in the extremity. Uh, the surgery that you have had, the doctors, as long as you've had your sutures out, that's the other important thing is if you've had your sutures removed or you've gone in for your first post-op appointment, then it's safe to say that you can go ahead and put your feet on here, but we just don't want to load. So make sure you're in a seated position and that your hips are sitting higher than your knees. That's why I'm using my stool versus using one of the white chairs. Because if I use one of the white chairs, I'm actually going to be sitting lower than the level of my knee, which puts more strain on the knee joint. So we don't want to put more strain on the knee joint. But if you've had your post-op visit with your doctor and you are now in the free and the clear of having the steri strips and the sutures removed, if you have exterior sutures, then it's okay for you to receive the vibrational energy from a non-weight bearing position. The first thing that we want to be working on is getting our toes moving. And this is how we start connecting the dots because the first thing that happens after we have a surgery is if I've had this knee worked on, then this whole leg is going to shut down. So a muscle's going to get really, really small. It only takes 14 days of not using muscle to lose muscle mass. So for every 14 days that you don't do any kind of form of resistance or exercise, whether it's walking or squatting, stooping, doing single leg exercise, riding a bike, things like that. So if you're not doing anything for 2 weeks at a time, you tend to lose 50% of the muscle gains that you've had in strength. And so we want to make sure that in the initial first 2 weeks after your surgery, most doctors are going to want to get you starting in gentle range of motion and getting this muscle to start firing again, which is your vastus medialis, your VMO. And you'll start doing that at home and working on usually straight legs. So you're tightening up the knee in a straight leg position, in a seated position with your leg propped up. One of the things that is really important that most doctors aren't aware of, that we know of in science right now from what clinical science suggests, is that 80% of the nociceptors that give our brain information and feedback about where we're at in space, our center of gravity, those nociceptors exist on the skin on the bottom of your feet where all of our happy nerve endings are. And so anytime we have a surgery on the extremity, there is a disconnect from the brain to the feet. And so the information travels through the pathway of least resistance. And wherever we have had the surgery is highly resistant because the body is trying to fix and repair. So it will reroute around it. So everything from the tips of our toes is affected, even though we haven't had surgery on the foot. So I like to get the feet moving. So whether it's wiggling the toes, whether it's spreading our toes apart, whether it's doing little gas pumps. So, like what I mean by gas pedals or gas pumps is you're pumping the gas in the car. You don't have to work range of motion in the knee in order to do this, but just moving the foot ankle is going to give you activation up the lower leg, but it also proves to being a pump. And when we have a lot of accumulation of fluid in our extremity, it helps to pump that back up into our lymphatic system so that we can manage it properly. And so by just having your feet on here, not doing any other exercise at all, and just working on moving the toes and moving the foot, it allows all of this to start pumping its way up towards our body. When you're able to start working on range of motion, you can start working on sliding your foot forward and backward on the platform as you're vibrating. It's not going to hurt you to do this. When your doctor does your surgery, that hardware is locked and loaded in that joint space. Uh, we have to make sure that we're following the recommendations of the surgeon and making sure that you're doing the range of motion appropriately on a limited range as you're instructed. But we have to make sure that we're doing at least that so that you don't scar into a position that's not so desirable. And then we have a bigger problem. So as your doctor is giving you permission to start working on this range, you can get better and better with using your leg while you're on the platform. Let me see what kind of questions we've got here. Silly question. Does the vibration help with the swelling and post-surgery icing regimen? Yes, it does help tremendously. So um, that's one good reason to get on the platform, is to help with the swelling and with the inflammation. Um, if you haven't had surgery, just lots of pain, I'm going to show you some exercises that you can do with this as well. So any kind of knee will work. Any kind of a knee problem typically will work with all these different exercises. Now, one thing that you can start doing immediately after you have your surgery is you can get yourself, I have my Life Pro Amber squishy ball here. You can put a kickball, you can put just a pillow in between your knees, but just by putting something in between your knees and just squeezing and holding that is activating these inner thigh muscles and the lower leg to start working properly again. And then you can relax, and then we can squeeze again. And we're not changing the alignment of the hardware inside the knee socket. We're doing, all we're doing is activating, and we're doing it from a non-loaded position so that we don't have to fight extra mass with gravity. So just by squeezing this is going to help in getting a lot of this activated. Okay. Now, the first thing that you're going to notice after a total knee replacement is you're actually going to have a lot of pain up here in the hip. So while I'm on the Rumble-X here, you can actually use one of our several massage guns. And I've got the Dynamini right here is one. I've got several others that are over here that are larger. But all I'm going to do, I'm not going to do this around the knee joint, but I have a lot of clients that I've worked with that have come out of a total knee replacement, and they are just, their back and their hips hurt them more because of the surgery. So we can start softening up some of those muscles on the outer on the outer thigh because all of those muscles have some kind of joint play with what's going on at the knee. So we can work here right on top of the leg. And again, we're not going anywhere near the knee incision itself. We're just staying right here on top, and you can even squeeze the ball at the same time. So we're getting activation of the VMO, which is what surgeons and therapists are looking for. We're getting our pelvic floor refiring properly because anytime you have a surgery, the first thing you lose is that pelvic floor and the muscle mass. So we got to get things firing again. We're stimulating through the bottom of our feet, which most doctors do not do because they're just not aware of the clinical research that exists with that stuff. There was a great article that was featured in Shape magazine this month with Dr. Emily Splickel, and she is one of the world's most rewarded podiatrists in research as it relates to not only emotion, but how our body is connected through the sensory on the bottom of our feet and barefoot training. And I've been learning from her for several years. And that's where a lot of my barefoot exercise training comes from. So, anybody in my facility who has had a lower body injury below the waist, we start working from the bottom of the feet at the great toe because if the great toe is not firing properly or your big toe is not working properly, then your butt muscle doesn't fire, which means your knee has to work a lot harder. And if you've just had a knee surgery, you don't want your knee to have to work any harder than it already is. So I'm just running this massage gun, the Dynamini, just up and down my thigh, nice and easy. And it's at an intensity that feels comfortable for you. Now, what you can do if you have trouble with getting range and you're wanting to work on scar tissue development from inside, is you can position your chair at different angles. So I'm going to turn my platform sideways so that you can see the difference here in where I'm starting versus where I'm at. Okay. And so I think most of all you can see that. So if so my hip is higher than my knee and I'm squeezing my ball in between my knees. Now, right here I'm about a 90-degree angle. And again, if I'm just wanting to use the massage gun up and down, I can help with any kind of hip or low back tension as a result of this injury or this surgery. Now, I don't recommend you do this on rollers on a hard floor, but if you want to take a chair and you want to move it further away, you actually get a larger angle in the knee here, which changes the vibration as to how it works through your leg. So if you wanted to work in squeezing the ball here and just doing little squeezes, we're still stimulating that muscle without having to put strain on the knee. And at the same time, I can provide, again, that massage gun experience, whether it's in my back or whether it's in my hip and my butt muscles here on the side, or whether it's working down closer to the thigh. Another area that people get really, really tight is down here in the calves. So you can lean forward just a little bit and get this in the lower leg and then work it through a little bit at a time, which will actually take pressure off of the knee. Because what happens after we have a surgery is everything goes into lockdown mode and tries to protect that joint. And so it's not so much of the problem here at the knee, it's everywhere else that causes more pain than relief. The knee is fixed, but everything else tends to hurt more. So if you use the vibration from the platform and the mechanical application of the percussion massage gun with the Dynamini or whatever massage gun you have, then you can soften up all of these massive muscles that generate a tremendous amount of force on the knee so that those are more soft and they're actually working and engaging as a pump to pull all this out of the knee. That's one way that you can do that. Now, the other thing that we can do is if you don't want to sit in a stool, but you're wanting to work the energy from closer to the platform, is you can actually have a seat. Okay, I have to assume that I'm one of you and I don't have mobility of the knee, right? Because we got to put ourselves into your shoes. So I'm going to lower myself. So if I can't move this leg and I can reach forward and lower myself down like such, okay? The problem is going to be trying to get yourself up off the floor, right? But if you want to position yourself so that your legs are on the unit, you can also do that. So again, I'm in manual mode. and it automatically starts for 10 minutes. Now, if I've just had surgery and this is really uncomfortable, then you can elevate and put some extra pillows on it. Okay. And so let me grab those right quick. If you have questions, please post any questions you might have. But you can take several pillows and stack them up on here so that you actually can use this to help with any kind of inflammation that you have from a lying position. Okay. So, and we can keep that knee bend where it's at. And if you're having trouble with getting your range of motion, then you can use that leg and you can pull and you can hold here and allow your heel to rest. And we're getting vibration working as a pump to pull this fluid out of your knee because your knee is probably going to be swollen like a grapefruit for a little while. And that is normal. So we can pull knee towards and we can let it fall, right? And then you can start activation. So now we're actually trying to get things to move. Now, if you're trying to work on quad strengthening, because many of you are being told to tighten the knee, okay, what you can do is you're just laying back and you're receiving this vibrational energy. You're going to pull toes towards your nose, and just doing that right there is activating your quad on some level. So just toes to nose, or like what I like to call our gas pedals. So you're pushing on the gas back and forth. And then as you get comfortable with that, then you can attempt to lock out the knee and release. So gas pedals, locking out the knee and getting full extension and release. And then if you want to put a towel around the bottom of your foot to pull so that you can really get that knee straight, you can do that, but you're able to enjoy the vibration at the same time. But again, you can just lay here and relax with gas pedals, okay? And then again, if you're wanting to work more on knee flexion, depending on what angle you're supposed to work at, you can position your pillows whatever height that you want to so that you're getting the proper angle in order to work on inflammation in that one position if you're exhausted and you don't have the energy to do what you need to do. So there's a lot of different things that you can do with the vibration platform, for the help for the benefit of working your thighs. Now, if I'm wanting to work strengthening from a seated position on the floor, so this is my total knee replacement leg, okay? And I've got my ball in between. You can just squeeze that ball in between your legs. And again, I'm receiving the vibration through my calves, but it's not going to rattle apart your hardware. That hardware is in there. You just want to make sure that you've had your clearance from your doctor with suture, your immediate post-op appointment with suture and or staple removal if that's applicable. Most doctors are using dissolvable stitches now, so you might not have to have any sutures removed. You just need to make sure you're talking to your doctor. But just squeezing the ball, we're getting that VMO, we're getting the inner thighs, we're getting the pelvic floor working at the same time. And then if we go to pull the toes towards the nose at the same time as squeezing, that's driving the whole chain through the great toe up into your hip. And you'll actually feel this in your abdominal region as well. So just squeezing whatever kind of object, whether it's a ball or a blanket or pillow, in between those legs. This is an easy way of how you can work on getting your strength back initially in the first couple weeks following your surgery. Okay, now from here, what I want to show you is how we can work on starting into progressing into squats, because that's going to be something you're actually going to have to do. And a lot of people who have had a total knee replacement are scared to death of squatting. But here's the thing, you actually have to squat in order to use the toilet. So you got to make sure that you have comfort when it comes to doing squats in a functional capacity. So are we asking you to do loaded squats? Absolutely not. Do you have to be able to grab the toilet behind you and squat back? Yes, you do. And so your doctor is going to give you, like I said, a certain range of motion that they want you to work through on that knee. And then once you've been told that you can do these squats, then you're good to go. So I'm going to just use my treatment table here as a way of showing you how to do these. If you have a high stool, you can use a high stool, but basically we're starting from a higher stance, okay? And from here, you're just going to work on just being able to stand comfortably and following those hands down to your knee and then standing back tall and locking those knees out. Okay, most doctors are going to want to get full extension with a moderate amount of flexion. Okay, and like I said, you'll work with your therapist and your doctor on that stuff, but you can still use your vibration platform to help with scar tissue development and to help with working with the edema and inflammation control and working on reactivation all the way up to the glutes and working with low back pain. So I have a lot of clients that come in after total knees replacements in order to help with pain management. So we're just squatting enough to make our hands in contact with our knees and then coming back up. Okay. So when it's a stance from the side, so it's going to look a little something like this. So we're just going to trace our hands. We're doing more leaning, and then you can sit back a little bit. Okay. Rise and then stand tall with those hands up. So hands come down to the knees. So we're leaning a little bit more forward, and then we're sitting back a little bit. That's when the knee angle shifts. And if you feel comfortable with that, then you can actually do more of a squat, assuming that there's like imagining a toilet behind you or a bench behind you, and then you can actually sit back. Okay. This is going to be one of the hardest exercises you start to do again, is into a deeper squat, because that knee is going to feel so tight that it can't go anywhere. The vibration is going to help to loosen that up. Okay. So that's a really good exercise right there. Now, what I want you to remember that you do when you are aligning your feet on the platform, I want to make sure, this is really important. I want to make sure that your toes are making parallel lines straight forward. So big toe is making a parallel line with your heel. So in other words, we don't want to have one foot standing in front of and the other foot behind. We want our feet to be aligned very much the same, in two lines that are parallel. Now, again, the closer that your feet are together, the less energy you're absorbing. The wider that your feet are apart, the more intensity and the more you're going to feel this. So if you're feeling something undesirable by going wider, how about we bring those feet a little closer together? And if you're still feeling really uneasy with what you're feeling from this standpoint, then all we have to do is offload it. So we just have to have a seat, okay? And if we have a seat and you're still really uncomfortable, then you're just going to lay your legs across the bottom of the platform with the calves exposed, and that way you're at least getting the vibrational energy up into the hips. So we're working on inflammation. Now, again, if you wanted to use one of your massage guns, and this is one of the bigger massage guns that we have. This is actually one of my favorites, the Sonic LX. When we go to use this unit, again, it's not so much about working on tightness in around in the knee, because we don't want to do it around the knee yet, but it's just working on softening up all the muscles above and below the knee, because if those muscles are really tight and not moving a whole lot, and you're trying to get comfortable and you're supposed to be seated a certain amount of time offloading that knee, these other muscles have a lot more power to become tighter, tense, um, not as active, and that actually causes more pain than the knee surgery itself. So by keeping these other muscles loose, is going to take more pressure off of the knee so that it can actually recover in the way that it's supposed to. Now, once you get to the point where your doctor gives you permission to start working on the scar tissue around your knee, that's when you can actually start working ever so slightly around the actual incision. And the actual incision line, you're going to want to use one of these more softer tips. Okay, doesn't have plastic. So when you're looking at the options, so in other words, this is not one that you would want to use around the scar. You want to make sure that it has a little bit of give to it. This doesn't absorb as much. It's more of a metal tip. So you don't want to use that. It's going to be too much. It's going to create more inflammation. But one of these soft rubbery tips is going to be what you want to use. And again, once your doctor says you can start working on the scar, then you're able to actually work on the scar itself and around it. Now, what you can do for that, if my scar is right here up in the middle, I know it's hard to see because I got the black on today, you're going to work around it, okay? So if my incision is right here up the center, okay, you're just going to work around it because you've got scar tissue developing in the perimeter of, and then your therapist can assist you with working on the actual scar line. Okay. But the idea using the soft tip is to working in all the areas around the knee as opposed to right on the scar. And like I said, the areas, especially below the scar, is also going to be really sensitive as opposed to right on the scar. And the scar is always going to be sensitive as well. But it's the areas that are more around the scar because most people ignore the tissues around the scar and it suffers from the most in general. So we're working all these areas all around the scar tissue, the incision line. And don't worry if your scar looks really, really ugly to get started, it's going to look better. It's going to look better and better as it goes. So I'll show you one of my clients, I work on a lot of total knees. I'll show you a picture before and after. One of my clients, I was doing house visits for this gentleman and I loaned him one of our platforms to use at home. He had way more hip pain than he had knee pain after his surgery. Uh, this, so this is his knee. The knee over here is 2 weeks post-op. And this picture right here is 48 hours after I worked with him and showing him how to do some of these different exercises at home. So that's 2 weeks after the surgery. This is 2 days after I worked on him. There's a huge difference in swelling because he just was sitting stagnant, not doing anything for a while. And then this is a year out. So the incision here is 2 weeks post, and this is a year out. So big difference in that scar, big difference in how functional the knee has become. And then now you can't even see his scar. In fact, he came in because he had his other knee done this year. And so he came in and showed me his other scar, and I had to actually shave his knee down to see where the scar lies because it had really kind of dissipated. So the scar will get better with time. So give yourself some time to heal from that. But one thing I want to talk to you about, though, and this is something I had done with him, is we have red light therapy. And the red light therapy torch is one of the devices that I've used with him over time in order to make sure that he's getting better. Now we have the BioHeal. So you could actually have this device, you can have the vibration platform running, you can have the BioHeal running at the same time. If this knee is the knee that I had surgically fixed, this one that's down, then I can have the BioHeal in front of me and actually radiating energy onto the knee while I'm doing all of this. You can multitask all of these different things at the same time. So I'm going to show you how to do that. And I know I've seen some questions pop up in regards to the Rejuva can you do red light therapy and the Rejuva all in the same day? And the answer is yes. The idea that we're trying to do is we're trying to get local red light or infrared light more localized to the area that we're trying to fix. If we've got one specific area, and in this case scenario, we're wanting to work more in the area of the scar management. So we're trying to manage scar and scar tissue. What red light therapy and infrared light therapy do is they regenerate new stem cells. Okay. It's lowering oxidative stress, which allows the body to heal more efficiently. It's improving circulation to an area. And naturally, because we're decreasing inflammation in an area, we're able to increase our overall range of motion, which decreases our pain. So there's coordinating relationships that go on with all that. And it's one of those things where you can use the red light therapy torch, the Lumicare, the Lumicare light therapy torch. You can use it a couple of times a day, 3 to 5 minutes at a time. I would say use it a minimum of 3 times a day with 2 to 3 hours in between each use, and just use the light therapy torch and just stick it on there for 3 to 5 minutes, and it'll kick off automatically when it's done. And again, you can do that a couple different times a day. We're going to use the BioHeal, and the BioHeal is more potent than the Lumicure light therapy torch. So if you wanted to do some exposure to the BioHeal in between the times that you're using the light therapy torch, you can do that. The BioHeal is giving more of a global experience with the light exposure, and that helps the whole limb. So Lumicure is local, so one pinpointed space. BioHeal is bigger area, and then the Rejuva is total body exposure. But we're trying to get a change going on a cellular level of as many cells as possible in the body to create a difference in homeostasis and how a body corrects and fixes itself. And then with the other devices, if you happen to have more than one red light therapy device, you're going to really focus more on the area that you're trying to fix. So would the massage gun affect any metal pieces in the bone to keep the meniscus secure from the surgery? His incisions are below the knee. No, you should be fine as long as you are past the suture point. After you've had the sutures removed, you want to make sure that you've got full range of motion that you're trying to restore. So if the doctor has told you can ride a bike, riding an exercise bike, then you should have no trouble with using massage gun. Now, again, I would not go right directly over the incision line unless the doctor has told you to start doing scar tissue work around the incision. If you've been taught that you can do incision scar tissue work, which means you're actually able to manipulate the tissue directly underneath the scar, that's what the massage gun is most beneficial for. You don't want to do that initially in the first 4 weeks. You can do that in the perimeter of wherever the scar might lie, because again, whenever we have a cut in the body up in one specific area, all the areas above it and below it and surrounding it have to adapt to that scar. So it's better if you work all the other areas in an adaptation of that scar versus doing it directly to the scar, because the other parts of your body still have to adjust. So that's what I would recommend, is working on all other areas of your body until your doctor says to start going directly on the scar. Now we're going to go ahead and turn on the BioHeal. And again, this is more, we're trying to create a bigger space, a deeper concentration of exposure. And we have got both infrared and red light. And I'm going to put the glasses on for safety precautions. Now, if this is my, let me turn this here so you can see. Now, if this is my, well, it doesn't matter which knee. You want to create spacing of about 1 to 2 feet. And my device is just a little too high. So I'm going to slide it out just a little bit in order to be able to give it more direct exposure right here. Now you can adjust it. So if I, let me grab another prop here. Doesn't matter what you use to set it on, as long as it's at the height you want it to be. There we go. Okay, so that, and I can actually feel the heat. Okay, so there I'm having vibration. I've got this going on. And if my booty is really stiff and sore, now I can actually work into my butt at the same time as I'm getting all this other stuff. So I've got the BioHeal on the knee. I've got my feet absorbing the energy through the platform, and I'm working out my low back while I'm standing and experiencing all of this greatness. Gosh, this feels really good. Okay, and I don't have a knee problem, but I work in a forward position all the time. If you're wanting to work on exercises, you've got your squishy ball, and you're just going to squeeze that ball while you're staying balanced on the device. Okay, now because the red light therapy is far away from me and I'm not in the line of the light, I can do this standing, a couple of feet away without having to wear the safety glasses. If you're sitting in a line with, and I'll show you what that'll look like here in just a second, and you're just using the BioHeal, then you're going to need to wear the glasses. So if you can see the bulbs in line with your eyes, you need to wear the glasses for protection. But just standing here is stimulating up to 90% of my muscle fibers to actually start working again, okay? So it's working a lot smarter, not harder, in order to get the whole body to work itself. So we're increasing circulation to that area of the knee. We are pumping fluid and gunk out of the knee and out of the lower extremity, because we have limited circulation immediately following surgery. We are getting the butt muscle to fire. We're getting our feet happy again. There's just so many things that are happening just by standing on the platform. And then by having the red light therapy exposure along with the infrared, we're getting so many great things happening all at once. So we're able to hack into the human body, hacking into the nervous system, and we are creating the opportunity for our body to heal at a faster rate, potentially, by providing an optimal environment. So I like to tell people, when you're using all these different devices together, you're turning your body into the opportunity to run like a Ferrari as opposed to running like a Mustang or like a Camaro. So the reasons to look into some of these other gadgets or devices is because Ferraris have to have a different set of tools, they have to have a different mechanic, and they have to have additives into their fuel, but they are pristine running performance cars that are different from just your everyday four-wheel vehicle. So if you're wanting to run at a higher level of performance, you have to do higher level performance hacks to the body in order to get it to run better. So let's be a bunch of Ferraris, I like to think. So I'm getting all this going on at the same time. Now, if you don't want the vibrational energy and you just want the red light therapy, you can do that as well. And so I'm going to take my white chair here. And I'm going to put my safety gear on. And I'm going to put myself just right here in the chair. Okay. And if I wanted to elevate my foot onto a step, I can do that. I can put my foot out here in front and it's hitting just right. Okay. So there's a lot of different ways that you can experience the red light therapy for helping with more accelerated healing, not only just in the knee, but remember, anytime we have surgery to one part of our body, it affects the entire line of our connective tissue fascia. So we don't need to just pamper the knee. We have to pamper everything above and below it, all the way up into the hip and into your low back. Excuse me. So it's really important for that. Now, if you're looking for other ways of pumping some of that inflammation out of there, we have the Access air compression boots. I've got those here, and I've talked about those several times, so I won't demo those now. But we've got the control panel for that, and these boots zip all the way up. And I've got clients of all different weights and heights, and these work on pretty much everybody that I've tried them on. But these boots, like I said, they do zip. So we don't have to worry about the Velcro coming undone. And they have 4 different chambers. So if you don't want to feel pressure directly over the knee, you can actually turn that chamber off and it will pump that gunk out from the foot, lower leg. It will bypass pumping around the knee, putting pressure on the knee, but it'll also pump all the way into the thigh. So it works all the way up, okay? But if you don't want that extra pressure around your knee, you can turn that chamber off so that there's no pressure on the knee. The other air compression boots that we have, you cannot do that. But the Access boots, you can actually turn the control panel on and select. I'll show you how this happens. So if we turn our control panel on, well, let's see here. I have grabbed a dead one, but I've got a charged one right here because my facility, we use anywhere from 4 to 8 sets of these a day. Okay, so we turn on the control panel, and if you see here, we have these 4 different lights, these little dots. When you push the position button, and so that the first one is your foot, the second one is the calf, the third one is the knee. If I push confirm, the light goes out, okay? The light goes out, and then now we can start, okay? If you want to turn the knee back on, you push confirm, and then it starts blinking, and then you can go right through the positioning. So again, if you don't want the knee turned on, then you're just gonna push that light to turn it off, and then you can just continue to position, and then you start, and it will do its full cycle. However, you're wanting to cycle your air compression boots, but it will skip. If the knee is part of that cycle, it will actually skip airing that chamber up. So you have the ability to do that, customizing your own program using that control panel. I use, if I were having a total knee replacement, I would have a set of these boots because it helps tremendously with swelling. It helps tremendously with pain. I would be on my vibration platform within a few weeks after surgery, and I would have a red light therapy to help manage the scar, to regenerate elastin, collagen, to repair the fascia, to regenerate stem cells, and to lower the overall stress. That would be my happy triad right there. So, red light therapy, vibration platform, doesn't matter which one you choose, and definitely the Axis air compression boots because it's all about feeling relief in specific spots. Now, the vibration guns, the massage guns, I like to say those are like a very specific point. So again, we're going local. So if I'm wanting to use a massage gun, it doesn't matter which one, what kind it is, just making sure if you're going anywhere near the knee that you're using a softer, more energy absorbing tip versus one of the hard plastic tips. But the idea of using a massage gun is not about going around the knee, but it's going above the knee, going into the glutes and into the low back, the hips, and keeping the rest of your body soft and fluid. Because when we have a total knee replacement, and your doctor has told you that you're limited as to what you can do, we get stiff, we get tight, certain things turn off, we get stuff like gunk gets stuck in those spaces and we can't get it out, and that actually creates more restriction elsewhere. So the goals with using the Life Pro products is number one, pain relief, and so we experience the pain relief by working on mobilizing muscles that should not be shutting down. Sometimes the worst thing we can do is just do absolutely nothing and stay seated or stay lying, and then the rest of our body starts to fuse itself or starts to become stiff. So being able to move, even if you can't move that one leg yet, being able to move, and I know many of you should be up and moving on a walker pretty quickly after you come out of surgery. So keeping pain under control. Then the next one is going to be working on inflammation, because the more inflammation we have in the knee joint, the less range of motion we get. So if we're trying to work on flexing the knee and it's really stiff and it's hard, if there's swelling inside of that knee, then we can't work on the range of motion, even though our doctor tells us we have to. So we got to work on getting that swelling out of there. And then the next line is going to be working on the range of motion. Once we work on that range of motion, we start to get the motion, then we can work on the strength. You can start working on strength, range of motion, and swelling all at the same time with what I just showed you at the start of this program. So I hope that helps all of you. Um, I'm seeing I'm 8 months post-op and have very good range of motion, but I'm still experiencing a lot of stiffness and discomfort. What's the best treatment for the stiffness? I also still have some tissue numbness in my outside lower leg. Is there anything that can help with that? Definitely so. The vibration platform is going to be really instrumental for that. It is very common to have neuropathy in the extremity after surgery because when they go through and cut into the knee, there is a chance that they cut through some of those nerves. And the nerve is the absolute slowest healing tissue in the body. It's slow, it heals super slow. And so when the nerve endings come back together, more often than not, they're not going to come back end to end. They're going to overlap a little bit. And then we have to train the brain to communicate through those nerve endings as opposed to rerouting information around it. Because the first thing that happens after an injury, after surgery, is our brain changes which channels, which direction or pathways it communicates, and is going to communicate the path of the least resistance. So wherever there is resistance, and there is wherever there's surgery and inflammation, the brain is going to work outside of those parameters. But the problem is we have to teach our brain how to reconnect back to what is normal, not what is convenient in the time. So the vibration platform would be my go-to for those of you who have joint stiffness or still have muscles that aren't working the way that they're supposed to, whether you've got full range of motion or not, and you've got neuropathy in the lower extremity, we've got to get those feet turned back on. And 80% of those nociceptors are on the skin on the bottom of on the feet. So we got to get those toes moving. We got to work our way up. And little by little, consistency is the very most important thing. So if it doesn't work immediately, like I said, nerve endings are super slow to heal. The older we are, the harder it is to get the brain to communicate with the rest of us. So we have to stay persistent. Even a little bit goes a long way each and every day. And when in doubt, come back to this video and have a look. If you also go on YouTube, I have an entire strengthening program just for total knee, total hip, and knee injuries in a sense. My mom has had a total knee replacement. I have a lot of clients who've had both knees that are done. The biggest challenge that we are seeing in the rehabilitation community following COVID for individuals who had surgery during the COVID pandemic shutdown was individuals weren't able to do the hardest part of their rehab during that time frame and developed scar tissue to the point that it solidified. And that scar tissue, when it solidified inside the knee joint, restricted the knee to being able to open and close full extension, full flexion. And so if you don't work on the range of motion to full capacity within that time limit that your body has before it starts to scar and become permanent, then you have to go back in and they have to break that scar tissue back up and they have to do it under anesthesia. And so it's like going in and breaking it all up again. And then you have to start the rehab process over. So most important is that first month, that first, 2 to 8 weeks out is making sure that you're getting the full range of motion, even when it doesn't feel very good. And like I said, the whole body vibration platform can help with that. The red light therapy can help with the regeneration of your cells and soft tissue. And then using massage gun can help with pain around the other areas of your body. And then, yeah, so it just getting those happy hormones going and working on fluid control. When it comes to other videos that are available, just type in on YouTube, Life Pro Amber Knee, and it will show you anything and everything on videos on how to do strengthening exercises for meniscus injuries, ACL reconstructions, patellofemoral injury, total knee. A lot of the rehabs are very similar. And so I walk you through a lot of those exercises and some of those other videos we've done in the past. So I hope you all have a wonderful day. Thank you so much for tuning in for the Total Knee series. And if there's anything else that we can do to be of service to you in following up on a video after this one, if it would help for you to have one of my clients who's been through total knee replacement come in and join us for a series and you can ask them questions, we are happy to definitely do that for you. Just we want to be of greatest service to you so that you can become a better version of yourself with our journey. So thank you all for watching today. I hope you have a wonderful day and I look forward to seeing you again very soon. Bye.